My name is Kyle Anderson. I'm an associate professor here at the University of Minnesota. I'm also the chief for Surgical Specialties Service Line. So the thing I like most about training residents really is it's fun. They're enthusiastic. It's fun to teach them and see them learn about the things that we're doing to help patients. And they really keep me on my toes. There's no better way to learn than know that you're going to have to teach someone. So it really makes for a fun environment. It's really interactive. It's also fun having young physicians around. They bring a lot of energy and excitement. Yeah, so the culture here at the University of Minnesota, I would say, is very positive and very collaborative. It's been that way for many years now before I got here, and it's persisted since. I think everyone's goal really is that we train the resident, that they learn what they're doing, and the best environment to do that is one that's supportive and positive. You know, some surgery programs, the old school way was very negative, and really no one here, I think, believes that that is the best way to go. So we've really focused on having a positive environment and that's supportive of our residents. When I started in medical school, you know, I looked at everything. There were two things I really liked. One was renal physiology. I really enjoyed that. And then I liked surgery. And originally what I wanted to do was be a transplant surgeon. And I did research in that area. I worked with them a lot during my first 2 years. The thing that I eventually used to decide what I wanted to do in medicine was I looked at the other physicians around me and said, are these people like me, and are they happy? I looked at all the different groups of surgeons that I worked with, and the ones that seemed to be like me and were quite happy with their jobs and their lives were the urologists. It's maybe an unusual, simple way to make a decision, but that's what worked for me. What's unique about the University of Minnesota? I would say probably the biggest thing is really the culture of the biomedical device industry that exists in the Twin Cities. There are many companies, many of which started here at the University of Minnesota. Medtronic, for example, started in the building just next to my office. And because of that, there's a lot of excitement, a lot of people working in this area, and that permeates through the medical center. That's something that just doesn't exist everywhere. I think really just a few places in the country have this level of interaction with the biomedical device industry. Most of my practice, I would say, is kidney cancer and ureteral repair. Those are things that I was trained on initially and have really developed an interest in. I love doing the surgeries. I love working with the patients. They're diseases we can dramatically affect with surgery in a really positive way. The majority of patients have really positive outcomes. So it makes it really gratifying. So those are, I think, the main reasons I enjoy working in that area.